In this Lumify case study, Dr. David Tierney is going to demonstrate how point-of-care ultrasound helped diagnose a small bowel obstruction. 12 hours after Kentucky Derby potluck dinner at a neighbor's house, the 69-year-old male presented to his primary care clinic with mild abdominal pain, nausea, vomiting, and an episode of non-bloody diarrhea. No one else from the party had become sick. On physical exam, his vital signs were normal except for mild tachycardia. His abdominal exam revealed mild distension, normal bowel sounds, mild tenderness to palpation in the upper left abdomen. His white blood cell count was mildly elevated, and his creatinine was mildly elevated. Otherwise, the labs were normal. Based on the physical exam and the labs, the working diagnosis in the clinic was gastroenteritis. The point-of-care ultrasound exam revealed significant dilatation of fluid-filled small bowel, to and fro movement of parasystolic luminal contents, and a distended fluid-filled stomach. Based on the ultrasound exam, there was a change in the working diagnosis. The ultrasound exam was most consistent with a small bowel obstruction, demonstrating the typical findings of a dilated small bowel, to and fro luminal content parasystolic motion. The patient was sent to the hospital for a CT scan and was subsequently admitted when his CT scan confirmed a small bowel obstruction without definite transition. Screening imaging for small bowel obstruction has historically consisted of abdominal X-ray or CT. Ultrasound has an increasing role in screening for small bowel obstruction with test characteristics better than abdominal X-ray as demonstrated in a recent meta-analysis. The clinical impact of this point-of-care ultrasound exam. If the patient had been sent home from the clinic with the diagnosis of gastroenteritis, he would have likely returned with ongoing and worsening symptoms. In this case, point-of-care ultrasound helped the physician determine the correct diagnosis and expedited hospitalization and appropriate treatment. Key learning point from this case: when using ultrasound to screen for small bowel obstruction, a pitfall may occur if the air fluid levels within the small bowel arrange themselves such that the air is up against the peritoneum at the point of incination. In that case, the point-of-care exam will demonstrate an air artifact that prevents the visualization of the dilated bowel. One must take care to scan more laterally, where it's less likely to have an air lumen interface against the peritoneum while in the recumbent position.